I'm Doug Boynton, and you're listening to WHRO's Weekly Edition, where we highlight the week's news and stories happening in our area. In this week's program, Hampton Roads is aging faster than the state and the nation, and that's a problem as healthcare shortages hit the country. WHRO speaks with Dr. Cynthia Romero about the recruiting challenges facing the region.
And I think there is also some part of fear in even some of the youth that saw the risks of being exposed to infectious diseases.
The Department of Veterans Affairs is making budget cuts, and there is concern that money cut from the VA might not stay in the VA. And a new mental health clinic on the peninsula aims to ease the burden on emergency rooms and law enforcement. It's WHRO's Weekly Edition. These are some of the stories that made news this week. A big undersea cable manufacturing plant finally broke ground in Chesapeake this week. However, as WHRO's Ryan Murphy reports, new federal policies may be a problem.
LS Greenlink will spend more than $700 million to build a factory capable of turning out miles-long subsea cables. It'll mostly sell to Europe for offshore wind projects there, which could cause problems if America's trade war continues.
Tariffs is a concern. If I say that is not a concern, I'd be right.
That's Koo Bon-kyu. He's the president of the South Korean company that owns LS Greenlink. Koo says the company will soldier on since there aren't many competitors manufacturing these kinds of cables for the wind industry.
Even with tariffs, you'll still have that market number one, and the pricing will be adjusted.
The company was lured to America in part by $99 million in federal tax credits. President Donald Trump has frozen payments from that program. Still, the Greenlink project is on. The 750,000 square foot facility is expected to be up and running by early 2028. Ryan Murphy, WHRO News.
Federal courts blocked enforcement of the executive order that the Virginia Beach School Board cited in its decision to eliminate diversity, equity, and inclusion. WHRO's Sienna Morales has more on the state of the school board's policy.
Some school board members said suspending DEI was necessary to retain the federal funds, which make up close to 10% of the division's budget. The U.S. Department of Education threatened to withhold money from schools that didn't comply. But 3 courts on Thursday blocked the order, saying it limits academic freedom and is too vague to enforce. Now, other board members want to suspend the decision and reinstate DEI.
The point of the resolution was that we need to be in compliance. Now, there's not a rationale for us to be doing this because there's an injunction against the executive order.
That's school board member Matt Cummings. He and others are calling for an emergency meeting to discuss the policy. Sienna Morales, WHRO News.
LGBT advocates say possible changes to Suffolk Public Schools policies for transgender and non-binary students would be a step backward. WHRO's Nick McNamara reports on how the school plans to handle it.
The school board is reviewing policy revisions that would require students to use pronouns that align with their gender assigned at birth, unless a parent submits a written request. School staff would not be compelled to use them. The updates would also mandate athletic participation and bathroom use to follow a student's gender assigned at birth, and strike specific discrimination protections based on gender identity. Julie Snell with the LGBT Life Center says the proposals would be
arguably saying that we're going to protect certain kids and not all kids.
The changes would put Suffolk's policies more in line with model policies introduced by Governor Youngkin in 2023. School Board Vice Chair Sean McGee says he's heard of abuses of the current policy. Superintendent John Gordon says those haven't been brought to administration. Nick McNamara, WHRO News.
We should note that both Virginia Beach City Public Schools and Suffolk Public Schools are stakeholders in Heretta, which holds the license to the WHRO stations. Healthcare worker shortages are a national problem, and Hampton Roads is aging faster than the state and the nation. That drives a greater need for providers. Dr. Cynthia Romero leads the Brock Institute for Community and Global Health, a part of the Macon and Joan Brock Virginia Health Sciences at Old Dominion University. She recently joined a statewide effort by nonprofit Claude Moore Opportunities to grow the healthcare workforce. WHRO's Ryan Murphy spoke with Romero about recruiting challenges and the new initiative.
First, can you give us a 50,000-foot view of how healthcare worker shortages impact people?
We see right here in Hampton Roads that there are some significant burdens of conditions like cancer, like chronic diseases such as diabetes and hypertension, infant mortality, maternal mortality, that are impacting our population that should be preventable or that should be addressed. And we should be doing better to help improve the quality of life and certainly the health and wellness of our population. And the way we need to do that, first and foremost, is to improve the healthcare workforce so that we have the workforce to have the healthcare system, to keep people healthy and well, but also to diagnose conditions early and to get the treatments that they need to live as healthy a life as possible. We have so many unique and strong assets, such as the multiple major hospitals and health systems. We have a medical school. We have a newly created Joint School of Public Health. We've got wonderful universities and community colleges, and we've got some growing and reputable employers who make this great ecosystem that just needs coordination, alignment, and collaboration.
What are the biggest barriers you've seen in attracting people to the medical field?
Oftentimes, youth and young adults may not be aware of the expansive number of opportunities that there are, but I also think that there may not be easy ways to access. Maybe individuals, families, communities may not be aware of how to start pursuing a career in those pathways. So what we are hoping is through this combined effort, regional approach, is to even partner with our school systems and certainly community partners across the region to talk about, not just the doctors, psychologists, nurses, but also the technicians, the assistants, and the aides and therapists that are opportunities that are good paying jobs, but also provide, this is job security.
There's a push in broader workforce development to capitalize on the region's population of skilled veterans and those just getting out of the military. How do they fit into this?
Claude More Opportunities really focuses on regional collaborative approaches that really support flexible education as well as providing appropriate training to be able to offer career opportunities, good paying jobs that will also improve the health of the individuals, families, and communities in our region. One of the newest initiatives that we have started is the Medic and Corpsman Initiative. We know that there are many active military and those who transitioned to veteran status that have tremendous experiences, skills, and training, in their time in the military, that oftentimes they cannot easily just step into a civilian role that is very similar to what they had while they were in the service. So what we are doing is facilitating the conversation to see where we can better match the skills, training, and experiences that they had in the military, see how we can connect them to the civilian equivalent, or to help support them with the additional education and training to step into those that require specific credentials, and then leverage that opportunity for them to help contribute to the health workforce.
Still ahead on Weekly Edition, without some help, an iconic Suffolk venue will be closing its doors. But first, early voting for Virginia's primary elections begins today. WHRO's Michelle Hankerson reports there are only a handful of primary competitions that Hampton Roads residents can vote in.
Primaries are elections between candidates in the same political party. They determine which person will be on the ballot for their party in November. There are only two primaries all Hampton Roads voters can participate in, one to pick the Democratic nominee for lieutenant governor and the other for the Democratic nominee for attorney general. Depending on where you live in the region, you may be able to vote in one of 8 other primaries. There are 4 for House of Delegates candidates and 4 for local candidates like sheriffs and Commonwealth's attorneys. To check if you live in one of those districts or cities, visit WHRO.org or elections.virginia.gov. Michelle Hankerson, WHRO News.
A who's who of offshore wind leaders from across the country gathered in Virginia Beach this week to discuss the industry's future in the wake of looming uncertainty. WHRO's Catherine Hafner stopped by to learn more.
Industry group the Oceanic Network hosts the forum to promote offshore wind's far-reaching supply chain. This year's event struck a somber tone as President Trump ramps up efforts to end the industry. CEO Liz Burdock acknowledged the challenges in opening remarks.
These are not normal times. 100 days ago, this momentum was targeted. Offshore wind found itself in political crosshairs.
Burdock asked members to, quote, stay in the fight. Meanwhile, Mayor Bobby Dyer said wind energy is on the forefront of the city's agenda.
You look at Virginia Beach, you're looking at the heart and future of offshore wind energy in this United States.
Dominion Energy's Virginia wind farm is one of only a handful in the U.S. that are permitted and under construction. Trump has halted almost all projects that are further behind. Catherine Hafner, WHRO News.
An iconic Suffolk venue could be at the end of its life without help. WHRO's Nick McNamara explains what needs to be done to save it.
The Planters Club has hosted fundraisers, club events, speeches, and weddings since it was built by peanut magnate Amadeo Obasi in 1925.
That's not only a part of Suffolk history, but it's part of my personal history.
That's Jennifer Berube, who was married on the clubhouse's lawn in 2018. The building was condemned in 2024 when engineers noticed its ceiling sagging, its trusses separating, and its walls bowing, among other issues. Renovations are estimated to cost $4.5 million, while a new structure would run $5.1 million. City Council has not decided which option to take. Mayor Mike Duman says that with the building stabilized, they have time to consider all possibilities. Nick McNamara, WHRO News.
Spring and summer bring thunderstorms, and storms sometimes bring power outages. Dominion Energy's Cerise Newsom says an ongoing job for the utility is identifying trouble spots.
We look at the most outage-prone power lines, and we select those to bury. And what we found is that by being strategic, that we're able to reduce outage times overall for all customers.
Newsom says it is cost prohibitive to bury all power lines.
Looking at where outages are occurring, what communities are experiencing power outages because of those overhead lines being exposed to more weather conditions. And strategically, we select those to bury.
And she says outages for customers with or near underground lines have dropped from 11 hours to around 2 minutes. And they're able to isolate problem areas quickly.
So we have sensors on our power lines overhead and underground that can detect faults or issues along those lines that interrupt the flow of power. And then we can use that technology to reroute the flow of power and just isolate a smaller segment of customers whose power is out and then fix that issue. So we get more people back restored more quickly, and then we're able to focus on the areas that need the repair.
Newsom says maintaining those overhead lines is a year-round job.
Trimming trees year-round that are close to those primary power lines in the rights of way is one of the other strategies that we use.
Newsom says 2,500 miles of Dominion's Virginia power lines have been converted to underground, more than halfway to the goal to bury 4,000 miles of cables. Like most federal agencies, the Department of Veterans Affairs is making deep budget cuts. VA leaders have suggested that money they save on things, like software or consulting contracts, will be directed into patient care. But they also concede that there's no guarantee that money cut from the VA will stay in the VA. From Norfolk, Steve Walsh reports for the American Homefront Project.
Well, it's good to be down here today. I'm glad that you're all here, and what an exciting place and time to be.
VA Secretary Doug Collins spoke recently before the ribbon cutting for a VA clinic in Chesapeake, Virginia.
I'm just going to tell you right now, I'm going to stand up for the veteran, period, end of statement. We're going to make sure that the VA has the resources it needs in the proper places, in the proper ways, so that we can make sure that the veteran gets taken care of.
This part of Virginia has one of the fastest growing veteran populations in the country, and the new clinic is opening with less than a third of the staff it will need to run at full capacity. Still, the Hampton region hasn't been spared staff cuts. 12 probationary workers were initially let go. Others have accepted buyouts. Collins has given the VA until August to cut 15% of its budget.
So that's a target. It's a goal. It's not a mandatory. Nobody has said it's got to be 15%. In fact, it may not actually get to 15%. But if we don't set a target for actually doing a hard look at who we are, then nobody's going to do anything.
The cuts from Collins and the Department of Government Efficiency could eliminate more than 70,000 workers. Every local VA, including fast-growing ones like here in Virginia, must compile a list of potential firings. Collins says the VA is also saving millions of dollars by canceling contracts. He says the savings will be rerouted to patient care. But the Trump administration has also talked about using DOGE savings to pay for tax cuts. And DOGE head Elon Musk has talked about sending checks to taxpayers. In the end, Collins says he cannot guarantee that all the savings will remain in the VA budget.
There's a lot of bloat in our government. There's a lot of things that we shouldn't be doing, and efficiency can be had. That'll be up to the president. I know one thing from the president. He's actually said, Doug, take care of my veterans.
The VA secretary says he isn't just working with DOGE to create his efficiency plan for the VA.
Folks that I brought in that are helping me, that came in with our political staff that's come, many of them have worked in previous administrations. A lot of them, several of them were in the Trump 1 administration in the VA. They know the system back and forth.
So far, Collins hasn't reached out to the Independent Inspector General's office, which investigates claims of waste, fraud, and inefficiency. The Inspector General was one of 12 fired by the Trump administration. The office is still issuing reports, including a recently released one from the Hampton VA, which pointed out providers were volunteering to work Saturdays to keep patient wait times down. Dr. Julie Kroviak is with the Inspector General's office.
We're hopeful that they would use our work to either support those decisions or to at least reach out to us to understand what our work might suggest would be implications of staffing cuts in various areas of VA.
While Collins' team looks for cuts, the number of patients continues to increase, especially in the Hampton area. A third clinic is already planned for Chesapeake. Damian Carr, a 26-year Army vet, says he used the older VA clinic.
It was always full. I mean, even COVID times, it was full. But they took care of me, and they still take care of me. I mean, if I took these hearing aids out, we wouldn't be talking.
Carr protested potential cuts outside the secretary's ribbon cutting.
You're going to lose the people that are providing the care because you can't hire them. Because who wants to come for a job that they're not sure about?
At Hampton, most of the 12 fired probationary employees were reinstated after a judge's order. According to the union, one worker turned down an offer to come back, saying he found a better job. Steve Walsh, WHRO News.
This is WHRO's Weekly Edition. Remember, for any stories you've missed, you can visit us on the WHRO smartphone app or all social media platforms.
A Hampton council member wants a greater reduction in the city's property tax rate in 2026. WHRO's Nick McNamara breaks down the numbers.
Carolyn Campbell was the sole council member to vote against Hampton's $460 million capital improvement plan. She didn't take issue with any one project in the plan, but says the city needs to temper its expectations and provide more tax relief to offset residents' rising property values.
All the stuff that's in there is wonderful. We just can't. I just don't feel like we can do it all.
Hampton's proposed budget reduces the property tax rate by a cent to $1.14 per $100 of assessed value. City Council will have another public hearing on the budget on May 7th before a final vote on May 14th. Nick McNamara, WHRO News.
Hampton Roads Rainbow Prom is today. The Creative Reuse Center helped students get ready with donated formal wear and a day of alterations. WHRO's Sienna Morales takes us there.
Volunteers transformed a vacated J. Jill in the MacArthur Center into a Technicolor cross between a boutique thrift store and a theater costume department. Teens could get alterations from the volunteer tailors ahead of P-Flag Hampton Roads Rainbow Prom, geared toward LGBTQ+ students. Party music played, colorful dresses lined racks, and the mannequins displayed Wicked-inspired outfits to go with the prom theme.
We get to think about our own proms, being able to identify why those events weren't so great for us, and being able to make the positive changes for the kids that are going to prom today. I think that's really where it's at.
That's the Reuse Center's director, Beth Dreyer. The Rainbow Prom organizers expect 125 students at this Friday's event. Sienna Morales, WHRO News.
Hampton and Newport News officials say a new mental health center on the peninsula will help ease the burden on law enforcement and emergency rooms. More from WHRO's Nick McNamara.
Ready? 1, 2, 3.
Peninsula elected and mental health officials cut the ribbon on the new B.J. Roberts Behavioral Health Center in Hampton, named for the city's first black sheriff, and a longtime supporter of growing mental health care access. Hampton Mayor Jimmy Gray calls it
a game changer for our region, and it will serve those experiencing mental health crisis in an environment specifically designed for healing, comfort, and stability.
The center is still waiting to receive its license, but when fully operational, will serve up to 32 people with various levels of service, as well as include room for 7 more people brought to the center by police who otherwise would be assessed or treated in local jails or emergency rooms. Nick McNamara, WHRO News.
Tuesday, the 29th, marked Fentanyl Awareness Day in Virginia, a topic embraced by Virginia's First Lady, Suzanne Youngkin. She and the governor marked the day Tuesday afternoon at the headquarters of the Drug Enforcement Administration in Northern Virginia. Before that, we had a chance to speak with her about the issue.
I think we would all agree that our youth are struggling. And too often in the midst of those struggles, they are turning to substances to cope. And there is a very dangerous substance out there. There are many, but one of the ones that we're talking about today is fentanyl. Fentanyl is an illicit opioid that's 50 times more potent than heroin. It's cheap, addictive, and is being put in fake pills that look just like well-known prescription drugs. The problem is it only takes a speck of fentanyl, the size of a grain of salt, to kill someone.
How do parents begin that conversation?
Well, you do not need to be an expert, and trust me, none of us are. And you definitely can't do it at the right time. Teens never give you an opportunity to have these conversations. But what I would suggest is that you visit our website. It only takes one.virginia.gov. On that website, there are all sorts of tips to bridging these conversations and knowing what to say, how to say it, and also resources to share with young people, things that will give them information on the dangers and what to look out for, what these pills look like, the fact that they don't smell any different than other pills, and just things to be on the lookout for. So again, it only takes one.virginia.gov is a great first step towards understanding how to really lean into and talk about the issue of fentanyl poisoning.
More than 100 young people died from fentanyl overdoses in Virginia last year. Resources, once again, at itonlytakesone.virginia.gov. You've been listening to WHRO's Weekly Edition. We had help today from WHRO's Catherine Hafner, Ryan Murphy, Sienna Morales, Nick McNamara, Barry Graham, and Steve Walsh. Thanks as always to Connor Worley, who produced today's show. A reminder, you can always catch full episodes on the Weekly Edition podcast feed. You can get your news updates at WHRO.org, the WHRO smartphone app, and the WHRO Reports podcast feed. For all of us at WHRO and WHRV, I'm Doug Boynton. Stay safe. Be well.